So thank you for joining us for our first virtual speaker series at the American Club. For this webinar, please note that your video display and audio will be switched off. By clicking on the chat icon, you can send your typed questions via chat box to myself, and I will filter questions coming in to be answered at the end. This webinar will feature a 30-minute talk with slide deck, as well as a 15-minute Q&A session. A recording of the webinar will also be available and shared afterwards in the club's digital news. So allow me to introduce our featured guest speaker, Dr. Susan Jamieson, specialist in integrative medicine. She has run our practice in Queens Road Central since 1994. Today, she'll share important information on COVID-19 testing and shed new light on the pandemic due to her extensive experience. Dr. Jamieson graduated in Scotland and trained in Harvard and Boston hospitals in the 80s. Her first role in Hong Kong was in an infectious disease respiratory ward. She became a consulate advisor during SARS and is presently a British Council advisor. So without further ado, Dr. Jamieson, if you'd like to take the microphone.
Thank you very much. It's a delight to speak to the American Club, and I know you have a very educated audience who probably read everything in the news. So what I'm going to talk about today is things that I know that will be less obvious and things you will not read in newspapers because now they are, or Google, because I've got a lot more to say that's not going to be there. So the first thing is that my first job in Hong Kong was in the tuberculosis infectious disease ward, and I'm going to make it really clear how this is related to coronavirus. First of all, surprisingly in the 80s, 10% of deaths were due to tuberculosis in Hong Kong, even though it was a first world country, a bit of a third world disease. Both of these, and this is the hospital, in fact, that I am not managing to move forward to for some reason. That's it. The Rotterdam Sanatorium was in Wan Chai. It was in those days before reclamation, you know, fresh air was a good thing. So it was right on the sea on the top of a hill to get the breeze. It was the oldest building in Hong Kong in the 80s. So very similar in that no cure had been found from this horrible infection transmitted by droplets. There were animal carriers. In fact, seals were said to have brought it from Africa to Europe. You know, all sorts of things with animals were going on. And even as I worked in this hospital in the 80s, of course, by this time there were drugs, thank goodness, but multi-drug resistance. So I was treating patients, and so were the nurses, that there was no cure. So if we picked up this strain of tuberculosis, there was no cure for it, right? So almost it seems like a similar situation to me. And I'm going to go back to this because it's a very interesting analogy. Now, we're talking about the coronavirus, right? So this is how viruses work. We have the information, we have the RNA of the virus, that the virus, as you know by now, gets into cells and then takes over the cells' mechanisms for making proteins. And then the cell makes the DNA of the virus using all its own nutrients in the cell. So it really infects and sort of kills the cell's mechanism and takes them over in a very alien-like way, I would say. Interestingly, that the original type of virus, because it's already mutated, you know, even in a few months in China, studies have shown that originally it was the S strain of the virus, but that quickly mutated to the L strain. And the L strain is now 70% of the virus that's around, the S strain only 30%. So viruses mutate all the time. It's just what they do, right? It's normal for viruses to mutate. So some information that you will not be familiar with is coming up. And this I got from a very confidential call between the head of infectious diseases in China, Stanford universities, Harvard universities, and all sorts of virologists. Statistics only up to the end of March, I'm afraid, but it gives us a really good idea of viral infectivity, which is so important because South Korea are the only people in the world who did a lot of testing, right? So the fatality rate, because what we all care about is dying of this virus, not having a runny nose and sore throat for 2 weeks. Fatality rates by age group and risk by age group. This is up to the end of March. So you see only at that point, only about 100 people have died. Now it's about doubled, but out of almost 9,000 testing, that's a lot. They found 111 had died, but fatality rates by the age groups, let's look at the 50s, 0.4% risk of dying in your 50s, 1.5% in your 60s, over 70, 6.3%. So obviously very risky for the elderly. And this is why a lot of countries like the UK, who are particularly slow on any measures, which is why they've got so much of it, you know, the first thing they did was was lockdown for elderly people. So this is really interesting. And we know that, yes, young people have had fatalities, of course, but statistically, they are not so much the ones at risk. And also here, the asymptomatic carriers, which is something we're talking a lot about now, right? Asymptomatic positives were actually up to 20% of the total tested. So they did test 9,000 people. It was a lot before March 24. And of that 9,000 odd people, 20% were positive but had no symptoms, which, as you know, is a real worry, because they're walking around the community spreading viral infections by droplet transmission. So there's a large study going on in Hong Kong at the moment. 3,000 people are being tested actually this week, which is really interesting because we'll soon get, I mean, next week we'll have results as to how many of them, you know, have actually had the virus and didn't have symptoms. So I think we're all familiar with the symptoms. I'm not going to talk about things you get on the news. As I say, that's not what I'm here for. However, the asymptomatic people, I mean, how infectious are they? Well, viruses, I mean, obviously coronavirus is a very infectious virus and seems to have about 10 times the fatality rate of normal influenza. However, viruses behave in a similar way, and they're at their most infective when you actually got it. You're coughing and sneezing, for instance. That means the viral load is high. Viral load is the amount of virus in your system. So more virus in your system, the more infective you are. Obviously with asymptomatic carriers, it's not that they're superhumans. It's just that they haven't actually got much of a viral load, and they've probably got a really good immune system, okay? So they have less of a viral load, therefore less infectious. And this argument goes through about infections, you know, do you get it from touching surfaces? Do you get it from walking by someone? Well, there's not, the whole point is there may be a bit of virus on that bit of cardboard plastic. However, first of all, there's no evidence because it's such a tiny viral load and the virus is not fresh. Second thing, there's no evidence that you actually get infected from it. So having on your bits of plastic and your bits of cardboard don't necessarily mean you'll get it because of the infectivity. So I think that's, you know, knowing a bit about how viruses tend to work, that may be vaguely reassuring from people, but it's not vaguely reassuring, of course, to know that 20% of people may be asymptomatic carriers, right? Anyway, we have to give the facts here. So what are the hopes for any drug treatment? So we'll go over this slide, which is that in the end of March, the clever and eccentric Frenchman Didier Raoult did trials on the malaria drug hydroxyquinine along with antibiotic Zithromax. And this is 16th of March, I believe. And basically, he found that in 6 days, 90% of people, sorry, 6 days, only 20, these are symptomatic coronavirus patients, right? 6 days, 25% only had the virus by proper testing, but in the ones who hadn't had the drugs, 90% had the virus. So those were very good results. And because of this, the French the health minister on the 23rd of March decided to use this combination of the antimalarial drug and the antibiotic. You've probably all read on the news about the equally eccentric looking Hasidic Jewish Dr. Vladimir Zelenko. I don't know why those guys always look eccentric and have beards, but maybe that's the nature of a pioneer, right? You know, that they're not in a white lab coat in Stanford. It's not them who are doing this, because he had another very good trial of 600, well, more than a trial. He treated people, Hasidic Jewish community in upstate New York, 699 people, and none of these people need ventilated. They all got better. So that's a pretty big statistic. None of them, 699, needed ventilated. So I just wrote this down, hydroxychloroquine, which is, we call it Plaquenil, and we use it in autoimmune disease. It's not really a malarial drug. I mean, it's related. More used in autoimmune disease, has its side effects, especially in heart disease problems, increasing QT intervals. And Azithromax, which you Americans know as Z-Pak, it's a common antibiotic. And it was a very brief treatment of 10 days, and you know, they got better very quickly, those patients. So, you know, drug trials are being done on this as we speak. But what was interesting from my colleagues pointed out to me that this gentleman in New York, Zelenko, used zinc also. Now, zinc is very, very interesting. I'm going to show you a slide later, because what it does is it's to do with the virus really entering the cell and destroying the cell's mechanism. Zinc actually prevents this. So zinc is a factor that unfortunately is not, you know how doctors tend to be very drug orientated, not nutrient orientated, even though, you know, the way it is. But zinc was used as a cofactor by this doctor, and is not being used in a lot of trials, which is unfortunate. So, but that's life. Hopefully something positive will come out of this, because seriously, a vaccine is going to be about a year away. So I'm going to talk about this more and move on to the next slide, which is a little bit about masks, and this is in Chinese. On the right, the stringy things are bacterium, nice big fat bacterium, E. coli. Come on here if you want. Nice big fat bacteriums, and on the left we have our smaller viruses, comparative sizes. But this is from my friend Professor Lee in the Hong Kong Hospital Authority. We gave a talk to the British Council. Definitely this stops droplet transmission. Remember, the viruses are contained in the droplets, okay? So, and quite possibly stop a lot of virus as well. So really worth wearing, and we have to note that Hong Kong, and cross fingers, we have no new cases. How good is that in one day? We've been so successful, bizarrely, with this, without closing all restaurants or lockdowns. So maybe this has to be looked at very seriously. And right in the beginning, the hospital authority were giving this information. Now, I'm going to move quickly on to why I keep talking about tuberculosis, because 18th to 20th century, 1/3 of people in Europe died. Similar, very similar to present days in New York. The ratio of black people dying to white was 3 to 1. Why? Because in those days, especially, overcrowded because of poverty, living closely together, undernourished also because of poverty, therefore immune system isn't so good. So sadly, what's changed in 200 years? The positive news here, as I said, there's so much, you know, correlation. In the old days, you know, public health measures work. So 1921, the French, who really lead the world in the vaccine and this sort of thing, with the Pasteur Institute, the polio vaccine. 21, the French invented the BCG, which prevented vaccine against tuberculosis. 1940s, we invented some of these antibiotics that we now use. However, it wasn't this that helped sort out tuberculosis in the world. It was public health measures. So that's why I showed a photo of this mask first. And I think this is a very empowering, positive message that we're all waiting for this magic bullet to come along, the vaccine, the drug, and maybe not. I mean, hopefully sooner rather than later. But 90% of tuberculosis that killed 1 in 3 people in London, 90% was decreased, the infection and the death rate, before there was widespread uptake of this vaccine. And a lot of great things came out of it, like the stethoscope and x-rays were invented off the back of this disastrous respiratory droplet disease. So it was good hygiene, it was sanitation, it was putting people to these sanatoriums in healthy, fresh air, separating them a bit from each other, getting them out of the crowded environments, encouraging them to breathe, because we forget that oxygen is the ultimate antioxidant, and antioxidants, of course, fight all bacterium and viruses. That's our body's natural immune system. Okay, so I'm going to bring us back to antioxidants in a minute, but this is why I like to talk. There's this very positive public health measure. Similarly with HIV, almost 40 people in the world have this nasty infectious disease. Nowadays, no one dies of it. Yes, because of drug. Well, that's not true. In the Western world, no one dies of it because of drugs. But before the drugs, the death rates plummeted because of public health measures, in this case, sexual health measures. Back to some advice. Vulnerable groups. I think we all know people with heart disease are top of the list, the elderly, the diabetics. We all know this information. The slides are there to be looked at later. One of my messages, everyone is in huge fear and anxiety. Now, we all know stress really does kill. Stress will completely deplete your immune system, and your immune system is your ally here. It's about your only one right now, to be quite honest. That's it. So I would suggest that we have to be positive. We don't hang around the anxiety inducers. I have a patient right now who watches news 5 hours a day, and I just had to give antidepressants to. That's, you know, one gets addicted, right? I don't want to miss anything. I want the latest news. I mean, I feel like that too. I'm a human being. Take responsibility for your stress levels and your positivity. We all talk about cortisol ruining our immune system, but in fact, there's 100 other factors that, not just the cortisol, but 100 other neurotransmitters that have a knock-on effect to our immune system. So I love to make this point to people. And the practical tips: eating well, healthy foods, try and get exercise in, you know, nature. And we all know about social isolating. So take a look at the slide later, because so much to talk about, right? I'm going to talk about, we've talked about boosting your immune system, how third world countries are going to be so badly hit by this because of overcrowding and malnourishment due to poverty, so their immune system isn't so great. For instance, did you know that vitamin C, which is great at boosting your immune system, has a direct effect at killing viruses also? Not many people know this. So studies have been done in China. High dose vitamin C really does kill viruses. I use it in my practice all the time for shingles, Epstein-Barr virus causing chronic fatigue. So I use it all the time to kill viruses. So I'm not surprised to hear this. Also, that's the virus killing aspect, but maybe what you don't know is if you have a cold, a simple coronavirus cold, within 24 hours, all the vitamin C in your body is depleted because it's used up, you know, the amount we get from our lovely green vegetables and citrus fruits, it's used up really quickly by the body's immune system, right? So that's why supplements work. Supplements do work. So, Harvard EDU tells us very clearly that after 1,000 milligrams orally, it's not, you know, 1 to 2,000, say, it's not really particularly absorbed orally, so we have to give it intravenously, which is why we do shots of it, both with people with, you know, say you've got influenza, you've got any infectious disease due to a virus, Epstein-Barr, shingles. There are protocols for all these things, and do it IV. One of the places you can go to very easily, and it's medically supervised with great nurses and doctors, is Revive. Revive Hong Kong give you booster shots of vitamin B, IM, and vitamin C. So I've just written this down. and some studies, but I've got many more studies, you know, of the coronavirus treatment, because obviously they're quite new. Coronavirus treatment of vitamin C. Moving on, a bit of a blurry slide, but zinc is so important. I remember I said it really works in the cell in coronavirus. It's got, I mean, a bit like tuberculosis, back to tuberculosis here. Tuberculosis, the bacterium didn't kill anyone, tuberculosis. The body's immune system went crazy, just like coronavirus. So coronavirus kills people because the huge inflammatory reaction, we call it a cytokine storm. Inflammatory mediators go crazy. So we want to modulate our immune system. We don't want to go crazy. There is a difference. So zinc deficiency will cause all sorts of horrible things to our basic white blood cells. That's the B and T killer cells. Zinc, it totally balances our immune system. So this is quite a nice slide here talking about balance. Macrophages are the big cells that go and gobble up all the weak infected cells, T killer cells. So antibodies are the white blood cell antibodies. B cells attack substances it doesn't like in the cells, but the killer T cells will gobble them up more. So I've made a package for people who want everything put together, the right amount of zinc, the right amount of C and other things here. If it can be of help to people, all my patients take this daily to protect them against any infection, but specifically, I've had help from a virologist making this as a protection against viral infection. And we've got two things that are really interesting here that have been studied in trials. Nutraceuticals. So astragalus is a Chinese herb used for centuries as a preventative, and it's a bit like ginseng. It's called an adaptogenic. It balances the immune system, right? It doesn't overstimulate, it balances it, adaptogenic. It actually helps raise white blood cells. It's actually been studied to be antiviral, antioxidant. So that's in my immune boosting package, and I can recommend anyone to take this if you want to take it separately at around 1 gram a day. And then we've got another one here, Sambucus nigra, elderberry, but these is better used together with a cofactor to other herbs. This is to help your natural protection. Actually reduces cellular viral entry, and it helps in immune factors interleukin 6, interleukin 8, and tumor necrosis factor, TNF. So this is obviously of interest to people, for babies over the age of 1 also. All my patients are on this, and well, I haven't seen any infections yet, so cross my fingers. Look after yourself. This is the time to get a checkup, right? I mean, we're all captive here in Hong Kong, and this is the immune system, the cell-mediated immunity, the antibodies, cell-mediated immune, different phases of the immune system, natural killer T cells, I love those, produced in your lymph, your spleen, your thymus, and complements another part of the immune system. So I do checkups on patients for this, and you might want to go to your own doctor also, because I mean, anything wrong with you will affect your immune system, liver, kidney, a bit of anemia. However, this is specifically to do with your immune system, so always nice to look after yourself. Useful information here. I'm sure you all have access to this stuff, but I always include it anyway. And I'd be delighted to take any questions you may have, and got a few extra things to say if you don't. So thank you very much for listening.
Thank you so much, Dr. Jamieson. I'm finding it hard to formulate questions as you've covered all the bases already.
Did my best there. Yeah, did my best very quickly.
No, it was very good. Thank you. We were wondering, would you be able to provide any additional information? Because there's been a bit of a debate in terms of incubation period for the coronavirus. There's been like so much different data shared on how long the incubation period is, and
This is it. It seems to be generally about 5 days. Remember, we've got the asymptomatic carriers. So they, I mean, you know, lots of people who've actually, you know, how effective are they? They will vary. So that's a different question, isn't it? But it's generally about 5 days, but it could be up to 2 weeks. So average is 5 days. And yeah, because not enough proper studies have been done on this. But my laboratory I use has come back to me and shared this information. That's it really. Testing I didn't cover, you know. So testing, blood or sputum sample, deep throat.
Okay.
And that's another one. The testing, blood is really easy to test, and it gives you an idea. You know, if you pick up the virus yesterday and you're just incubating it, it will take a few days to have some antibody production, and we're testing for antibodies in the blood. When I see a few, 3 to 5 days. So I suppose what we're saying is really the blood testing will be positive once the incubation period has, you know, once you've got enough viral load to detect it. Whereas the deep sputum sample is going to be actually looking for virus very closely, and so it's a slightly different test.
And could you shed light on whether the blood test or the sputum test would be more accurate, or would you say that both are rather accurate depending on?
Okay, we call it specificity and sensitivity with blood tests. That means false positive and false negative. Now, your false positives are what you, I don't think you're going to have many false positives, but the false negatives is what we really worry about, and you know, we don't want to miss things, right? So the lab I use has 98% specificity and sensitivity, which is roughly 98% false positive and false negatives, okay, which is really good. For any laboratory test, that's normal, because any test, I'm afraid, has false positives and negatives. The thing is, as I said, if you have to wait 3 to 5 days after a patient is infected, you'll start to get the antibodies enough to test.
Right.
So I guess that would be the false negatives, right, if you do it too early.
Okay.
The other test will have false negatives. That's the testing PCR, polymerase chain reaction. That's a test for the DNA of the virus, PCR test from the actual deep throat stuff. Because as you know from the press and all, the virus starts replicating in the throat first, and then when it causes real problems when it goes into the lungs. And its nasty little spiky exterior has a great affinity for cells and sticks very nicely. So that test, you're going to get false negatives simply because people aren't doing the test properly, right? I mean, you know, if you give someone a throat swab, they'll never do a proper test themselves. It's difficult to do a proper test. Patients don't like it. It's really uncomfortable, borderline painful. You stick it up really quite far up the nose or quite far down the throat. First thing in the morning is the test we do for sputum when they have not eaten or drunk anything, and you really get a patient to cough stuff up. And okay, it's a bit of saliva there, okay, but it's first thing in the morning and you really cough, believe me, you'll get stuff from your throat up. And that is a good sample and much less likely to have the false negatives.
Great. That definitely answers the question.
Yeah, because it's a really good question, and I know there's confusion over it, but we can be quite definite about it now. Yeah, we can. And anything else you're particularly thinking of asking right now?
I think that's all on my end. Dr. Jamieson, I just...
Yeah, cool. Yeah. People worry about surfaces and touching surfaces. So I wanted to you know that Princess cruise ship. Well, there was virus found there after 19 days in the rooms that had not been cleaned. Now, yeah, virus found there, it hangs around. Was it live? Could it have infected anyone? No. So that people not thinking, you know, you have to know how viruses work, right? Secondly, the study in New England Journal of Medicine that showed that in I don't know why they did it on copper, metal, I guess. Copper, it lasted for 4 hours. Cardboard, 24 hours, 1 day. Plastic and steel, 1.5 days. So, but again, could that have infected someone, right? That's a different question because the viral load is tiny and it's not very active. Obviously, it's a possible, but it's a very small possible, but still a possible, which is why obviously people are being so careful to touch things, you know, taxi door handles, doorknobs. So I know people always ask that question. So I think we've covered a lot there. I think that is kind of up to date, and also that you won't read in the press, which was my intention.
Mm-hmm. Dr. Jamieson, thank you so much on behalf of the club and members. Your professional insight on COVID-19 has definitely, we've picked up a lot of valuable information that we can use today, and it's been a real pleasure. So thank you so much.
It's been lovely talking to you guys, and we can do it again anytime, but I guess you've got the recording, which is fabulous.
Yes, and so this will be shared via the club's digital news, and I'll be able to share that with you as well.
Oh, that would be wonderful. Thank you so much.
Thank you, Dr. Jameson. Have a great day.